Welcome to this educational video on aortic regurgitation. The heart, that tireless engine within us, relies on a series of valves to ensure blood flows in the correct direction. When the aortic valve, the gatekeeper between the heart and the aorta, doesn't close properly, blood leaks backwards. This is aortic regurgitation, also known as aortic insufficiency. Join us as we explore the causes, effects, diagnosis, and management of this important heart condition. Aortic regurgitation has several potential causes. These can be broadly categorized into problems with the valve itself or problems with the aorta, the large artery exiting the heart. Valve problems may include congenital defects present at birth, rheumatic fever leading to valve damage, infective endocarditis, a bacterial infection attacking the valve, or degenerative changes due to aging. Aortic problems leading to regurgitation can include aortic aneurysms, or dilations of the aorta, aortic dissection, a tear in the aorta's inner lining, and certain connective tissue disorders like Marfan's syndrome that weaken the aortic wall. High blood pressure can also contribute to the development and progression of aortic regurgitation. In some cases, it is related to other conditions, such as lupus or ankylosing spondylitis. So, what happens inside the heart when aortic regurgitation occurs? Normally, the left ventricle pumps oxygen, rich blood through the aortic valve into the aorta, which then distributes it to the rest of the body. With aortic regurgitation, some of this blood leaks back into the left ventricle during diastole, the relaxation phase of the heart. This causes the left ventricle to work harder, pumping more blood to compensate for the backflow. Over time, this increased workload leads to left ventricular hypertrophy, or enlargement. Initially, the heart may be able to compensate, but eventually the left ventricle weakens and can no longer pump enough blood to meet the body's needs. This can lead to heart failure. Aortic regurgitation affects people of all ages, but it's more common in older adults due to age-related valve degeneration. The prevalence of aortic regurgitation increases with age. Men are also more likely to develop aortic regurgitation than women. The occurrence of certain underlying conditions, like rheumatic heart disease, varies geographically and contributes to the overall epidemiology of the condition. The global burden of aortic regurgitation reflects the interplay of these factors, including aging populations and the prevalence of risk factors. The signs and symptoms of aortic regurgitation can vary depending on the severity and how quickly it develops. Some people with mild regurgitation may have no symptoms at all for many years. However, as the condition progresses, symptoms may include shortness of breath, especially with exertion or when lying flat, fatigue, chest pain, particularly during exercise, palpitations, or a feeling of a rapid or irregular heartbeat, lightheadedness or fainting, and swelling in the ankles and feet. A characteristic sign detected by a doctor is a heart murmur heard through a stethoscope. It's important to note that these symptoms can also be caused by other conditions, so it's essential to consult a doctor for proper diagnosis. Diagnosing aortic regurgitation typically involves a thorough physical examination and several diagnostic tests. A doctor will listen to your heart with a stethoscope to detect a characteristic murmur. An echocardiogram, an ultrasound of the heart, is the most important test. It can visualize the aortic valve, measure the amount of backflow, and assess the size and function of the left ventricle. Other tests may include an electrocardiogram, ECG or EKG, to record the heart's electrical activity, a chest ray to look for an enlarged heart or fluid in the lungs, and cardiac MRI to obtain detailed images of the heart and aorta. In some cases, a cardiac catheterization may be performed to directly measure pressures in the heart and aorta. Aortic regurgitation can be classified based on its severity. Mild regurgitation often causes no symptoms and may not require immediate treatment. Moderate regurgitation may cause mild symptoms and may be monitored closely. Severe regurgitation causes significant symptoms and usually requires intervention. Aortic regurgitation can also be classified based on the rate of onset. Acute aortic regurgitation develops rapidly, often due to infective endocarditis or aortic dissection, and can be life-threatening. Chronic aortic regurgitation develops gradually over time, allowing the heart to adapt to some extent. The treatment and management of aortic regurgitation depend on the severity of the condition and the presence of symptoms. For mild regurgitation with no symptoms, regular monitoring with echocardiograms is usually sufficient. For more severe cases, medications can help manage symptoms and reduce the workload on the heart. These may include AC inhibitors, angiotensin receptor blockers, beta blockers, and diuretics. Ultimately, severe aortic regurgitation often requires surgery to repair or replace the aortic valve. Valve repair is preferred when possible, as it preserves the patient's own tissue. If repair is not feasible, the valve is replaced with either a mechanical valve or a biological valve. Minimally invasive surgical techniques are increasingly used for valve replacement. Lifestyle modifications, such as a heart-healthy diet, regular exercise, and smoking cessation, are also important. While some causes of aortic regurgitation are unavoidable, there are steps you can take to reduce your risk. Preventing rheumatic fever through prompt treatment of strep throat infections is crucial. Controlling high blood pressure and cholesterol levels can help protect the aortic valve and aorta. Preventing infective endocarditis through good dental hygiene and prophylactic antibiotics before certain medical or dental procedures in high-risk individuals is also important. Individuals with a family history of aortic disease, such as Marfan syndrome, should undergo regular screening. The prognosis of aortic regurgitation varies depending on the severity of the condition, the presence of symptoms, and the overall health of the individual. Mild regurgitation may not affect life expectancy. However, severe, untreated aortic regurgitation can lead to heart failure, arrhythmias, and sudden cardiac death. Surgical intervention can significantly improve the prognosis for individuals with severe aortic regurgitation. Recent research focuses on improving diagnostic techniques, developing less invasive surgical approaches, and exploring new medications to protect the heart from the damaging effects of regurgitation. Ongoing research also explores the role of genetics in aortic valve disease and potential targeted therapies. New valve technologies, such as transcatheter aortic valve replacement, or TAVR, are being investigated for patients who are not good candidates for open heart surgery.